autistic adults, whether they need disability services or general adult social services, or are just trying to go to healthcare to have ordinary health problems sorted, often find that we don't seem to have the right to services like everybody else. It's an ongoing problem. Also applies to people who may just need a little accommodation in the workplace. No, nothing that would necessarily cost or cause any work to anyone, just understanding. So in Finland especially, I think the lack of universal quality needs assessment is an enormous gap. And also what Silke described, which is the lack of real legal rights, access to a process where you can apply, complain and reapply. Kim, how is it in Sweden? I know you have slightly better legislation than we have, but maybe not perfect.
No, it's not perfect, but we have the discrimination board where you can make complaints if ever you have some kind of issues on that. But it's always like this. It's more easy if the case are more concrete and if it's a visual disability for some, in some way, than if it's a kind of neurodiversity case and it's not really clear what it's all about.
You are able to get the help more because you are visually able, not because of your autism. And yeah. if you would not be visibly able, it could be that you would not get the right help, or more the help, the amount of help you would need actually.
Yeah.
Some years ago, when I read about Sweden, what was mentioned was LSS-laget, and a list of things that any municipality had to consider, types of services. And that's what we were lacking, so I thought that was pretty good. But I also seen people complain about the list, like it does not include all the things that should be there, or maybe there should be a different list for those who are not disabled.
Yeah. The problem with LSS law is also, first of all, it's as you say, compared to many other countries, is a good law, and it helps a lot of people. But one problem is there's always up to a kind of official to take a decision. Do you really need this or not? If you get dependent on these kind of services, even the goal is it's a good goal from the beginning. If you get dependent, you will never develop, as a person on your own. So it's a kind of a thin line to balance there.
Yes, with any kind of disability support, it's the same thing. Yeah. Pretty much people do have to think, when you're young, you need to try and reach the level that you can reach.
Exactly.
Someone like me, over 50, no, I think I'm not going to be significantly more normal here, or functional in any way. So then it's a matter of finding the support that allows maximum independence in other things.
Exactly.
Because otherwise, okay, I'm independent that way, but in everything else, I am actually more dependent. I have to ask family and friends. I have to exclude things from my life that I want to do, and so on.
And also, if you want to try to reduce, you cannot reduce as you want, because then you can again come in the situation that you need not enough help. And if you want to try you out, you should be able to say, okay, I want to try out to reduce, but with the option that it's reevaluated in a good time. And it can automatically set up again if it was too much.
Yeah.
And if this is not possible, if you just say you can have one level or level 2 or level 3, and if you are less than this, then you cannot get anything at all. this is not meaningful because on the one hand, you will try, and also if you are stressed, you need more help. If you're less stressed, you can try to have less help. And all these things are things that there's no understanding. And often also the problem that the quirky profile, yeah, I am able to work 30 hours with IT, but I'm not able to use a stove. Or on the other hand, the point is I'm maybe not. Some people are or have difficulties to go to the bath and shower and all the things. Maybe also because of the sensory issues. But then this is not understanding that they need help for personal things like cleaning and all these things, but can work full time in other parts.
And that's another negative experience we have in Sweden. As an autistic, if you have executive issues or challenges, making it hard for you, for example, to use a stove, they're very keen to give you help with that. They say, okay, you don't need to do that. It's okay. But if social interaction is hard for you, you're forced to train social interaction. So it's like it's more Swedish society value more that you should be socially correct and able to get out and socialize with people than to actually manage to live your own life. And that's horrible. Of course, if you need, I don't say if you need help with daily life, of course you should have it. But on the other hand, if you can choose between, if the choice is between socializing and living your own life, I think it's more important to be able to live in your own life.
I meet more than one time situation. Oh, you're working. Then it's not possible that you could need help with. Then they just say, no, we do not believe that you're not able to use the stove in a right manner, or that you would need cleaning help and all these things. So this mistrust, this extreme mistrust. You are able to do this. Then you're of course also able to do this, or the other way around. If you're not able to do that, you cannot be able to do this, and this is a conflict which is really bad for a lot of things. For my personal, it's just like, okay, I have to apply for help at the municipality, but at the same time, I professionally should help exactly these people with complex IT things, which means I have three possibilities. They don't understand me at all, or the worst case, the case can be they cannot understand my need of help because of my professional. Otherwise, they understand my need for helps, but will not trust me on the professional side, or in worst case, they don't understand that my need of help and at the same time mistrust me professionally, and therefore I'm sitting there and saying, even though I would need help, I don't apply for it because I'm too scared that it could give problems in my job. Even though I know that it will not give problems directly in my job, directly in my area, but it could give problems in other states. And this is something where I think it's really, really bad if you scared of applying for help because you're scared that they will mistreat you.
This is the problem. We are scared of mistreatment and moral judgment, aren't we? I see this particularly clearly because I have a slight progressing visual impairment. and as it has affected some practical aspects of my life, I have become a VIP. I suddenly find a disability that's less than my autism is suddenly treated with such enthusiasm. People are falling over themselves to help. The service is totally on a different level. This I find astonishing, you know, to the extent to which it happens. Background.
Cops.
Help is arriving.
They come in to take us away. Yeah.
No, it's the help with your
Yeah.
visual issues.
Yeah. So there is no assumption of any need for shame or you know, fear of mistreatment. People are simply doing things more than I need, you know, immediately and automatically. And enormous contrast to how you are treated as an autistic person with limitations. You know? And I keep thinking, well, that's how it should be. You know, if I get lost, you know, because of visual impairment and I need someone to accompany me, that's fine. Someone else gets lost because they have poor orientation. No, they need to be taught forever. They need to be made feel bad about not learning. They are just as impaired as I am or more.
Or even because of sensory overload.
Yes,
Getting
that
lost
too.
because of sensory overload, they cannot understand.
Yeah, yeah. So, as a, you know, within the disability field, we are at a disadvantage. And it's so much of that is attitude, and on our part is also internalized attitude and fear of attitude. Because the Estonian system is somewhat different, say from Finland, Sweden, Denmark. Do you have any comment on the services side of things that you might want to add to this?
In Estonia there's available some social rehabilitation and work rehabilitation, and these programs are sometimes for 2 years or so, but to have a support person, it's usually for people who have physical disabilities, and not so many autistic people have applied for it, and they are not very often given this support. It's more to the children. It's daycare help for parents, for families, but for grown-up people it's quite seldom probably. We don't know very much. We don't know very many people who have this kind of help.
And they don't think of applying. No.
Yes, many people don't think of applying at all. They just stay at home, they are depressed, they would need help, but they kind of don't have the faith they could have it, and the applying process is too hard for many, and so they don't try to get it.
Ja siis on isiklik abistamine füüsilise puudega.
And if there is a physical disability, there is this individual support person help. It's more available for those people.
Is that volunteer or is it a paid assistant?
Palgaline.
Paid.
Toetab.
Local municipalities should pay for that, but of course it's different. Some municipalities are more willing to give money and support, and some families, even with children who have problems, have no, because the local municipality says, no, we don't have this kind of problems, and we don't give you any money and any support. I have heard these kind of stories as well. I think some help is really professional and good in Estonia. I really believe, because I have had some good help from that side.
There is a lot of autistic adults in Finland. If you ask them about service, that is also their understanding of autism service, that it means a period of rehabilitation of some kind, and they don't think in terms of permanent disability service or disability benefit. So very much the same thing, they don't apply. Even if to any objective person it would seem that their lives are seriously limited. No, they've just learned to think that maybe
Accept the
yeah,
limitations.
think that that's how their life is supposed to be. No,
Yeah.
it doesn't even occur to them it could be different or should be different.
Yes.
So then those of us, of course, who demand are seen as very difficult individuals, because we've always dealt with that kind of person like this. And
But I have also heard about that some people try to misuse the system and try to so neurotypical people trying to make face that they need the help, although they are seemingly doing quite well. So of course for third person it's always hard to assess which is somebody's real need, but I have heard that some people try to apply for help although they don't need it so much as some others who are in too weak situation to apply for help. So to apply for help you have to be in some level already, and if you are above that level you just won't try. But somebody who, yeah, for some it's kind of for lazy people also, or not lazy is not good word, but yeah, we all would like to have some more help and more money and whatever. So it's complicated.
yes, it is, and I think the Finnish system probably has a bit more to give than the Estonian one, in terms of resources and everything. But I see it as tremendously unfair sometimes, in that you have to be very good at applying. My strength tends to be in logic and
Yeah.
being verbal and persistent and a little bit nasty, and all of those help. And then you see someone who's got more impairment than me but doesn't have those exact qualities. No, they don't get it. And unfortunately I can't help. I can't go through those processes many times with many people, and that's a gap in the system. We do need someone who does exactly that, and that would be called independent advocacy.
But I know in Estonia there are people who are working, so they are helping people to application. So if somebody is in very low, but he or she knows somebody who's working, so you can ask a help in application, in asking for help, because it's not so easy, and some people know it, and it's in municipal paid work.
So that is part of the system.
Yes, so there are some people who are really willing to help those people, and I know somebody who has got help from that system, who was too weak for applying.
So if any country has that organized in a good way, that would be something for all of us to look at and copy, or at least point out that, look, it can be done.